Hi, thanks for being here. Glad to have you. Today, I want to talk about the number one mistake that people make when treating peripheral neuropathy. This is a topic that's going to affect a lot of people. So, I want to talk about what happens with if you just focus on the treating the symptoms as opposed to digging down a little bit and figuring out the root cause of the symptoms. Some of the symptoms of neuropathy include um, pain, burning pain, electrical jolts, numbness, tingling, um, muscle weakness, muscle pain, coldness in the extremities, like your feet feel too cold, or you have severe and progressive balance problems. And the medical doctors typically like to address those components, but they don't really go after the root cause of the problem if you go a couple layers down. So, what I want to do first of all is as invite everybody to comment below about what kind of problems that you've been experiencing, whether it's balance problems or it's pain or it's numbness and tingling in the feet or numbness or a lack of sensation. A lot of people tell me that they feel like they're in the balls of their feet, feels like their socks are bunched up, they're losing sensation there. Or on the other side, it's oversensitive. So go ahead and comment below and share with me about what kind of symptoms that you've been having. The mistake that I want to bring up is that the mistake is that people treat neuropathy like a symptom instead of looking at the overall picture of what's driving the symptom in the first place. And so most people, and unfortunately most doctors, will focus on the symptom relief and they'll use medications like gabapentin, also known as Neurontin. One's a generic, one's a brand name, or they'll use Cymbalta, or they'll use Lyrica. Those medications don't really address the hidden root cause of what's driving these symptoms in the first place. And that's the reason why the symptoms not only linger, but they over time they get worse. And as they get worse, the doctors respond to that by increasing the dose of the medication. And so you start off like going to your doctor, your family doctor, or a neurologist, and you say, I got this problem. And then they give you a prescription for gabapentin. And they start off with at 100 milligram tablets once a day. And then you go back about 6 months later and say, Doc, this is no longer working. I need something more effective. So they give you the same drug, but this time he wants you to take it morning and evening. So you take it twice a day. And then they bump it up to 3 times a day. And then they bump it up to 200 milligram tablets and then 300 milligrams, and so on and so forth until your body just can't tolerate it anymore. And meanwhile, the damage that's driving the problem in the first place keeps on getting worse. It's like disconnecting the smoke alarm instead of addressing the fire that's going on below the surface. So conventional medicine is built on managing symptoms. Whenever you take a drug, whenever you take a medication, it's been built upon managing the symptoms. The first three medications, gabapentin, Neurontin, and Lyrica, are actually anti-seizure drugs. They were actually formulated to treat epilepsy. And the fourth medication, Cymbalta, is an antidepressant. These drugs were never formulated to actually address the root cause of the problem. And as the problem continues going on and getting progressively worse, it continuously it doesn't address any of the hidden root causes of the problem. And so the patients are told, I'm sorry, there's nothing more than we can do for you. You're just going to have to learn to live with it. So, peripheral neuropathy is a progressive and degenerative disease. What that means is that it gets worse over time, and the intensity and the frequency of the pain keeps on getting worse and worse and worse. And so the medical doctors want to chase that with medications, but that's not the hidden root cause of the problem. And this is where hope gets taken away. The masking the symptoms creates a false sense of security. So you think you're doing something about your problem, but in reality, it's not touching the issue at all. It's not affecting the progress of what's going on. So the nerves have the ability and capability to heal if given the right environment. So there's a couple things in the peripheral nerves that it needs to heal properly. First is you have to have an abundance of oxygen. Oxygen is required by every cell in the human body for normal function. And if you cut off the blood supply and with that the oxygen supply, then the tissues start to heal, they start to die, and they lose their ability to regenerate. Secondly, they need to be stimulated. And we offer electrical and mechanical stimulation. And third of all, they need to be in the proper environment. So you have to make sure that you're not accidentally consuming too much sugar, or you don't have any nutritional deficiencies, or there's any kind of type of thing like chemotherapy or certain statin drugs that can wreck your body function. So, what should happen next is that you should make sure that you're getting plenty of oxygen to delivery to the nerves, you're getting plenty of mechanical and electrical stimulation, and you're managing the internal environment of your body. Um, I'd like to ask a favor, if you could, if you found some value in this video, please like and please subscribe. It helps with the YouTube algorithm tremendously. So like and subscribe to the video and share it with a friend. And lastly, I'd like to say that I have a free 2-minute quiz. It's a free 2-minute neuropathy health assessment that you can take at home just by clicking on the link. I'll provide the links below in the description area. So please click on that link, complete the peripheral neuropathy health assessment to find out where you are with this problem. Is it mild? Is it moderate? Is it severe? And what do you need to do about it instead? So thank you very much for checking out this video. I look forward to having you watch the next video. In the meantime, click on the link above to see another video, and I wish you a very happy day. Take care.